JC is an American Indian 40-year-old female. She presents with abdominal pain, nausea, vomiting, as well as dehydration. It's important to note that within her labs, she shows high levels of glucose as well as lipase. Now, high levels of lipase indicate issues with her pancreas, which is why there is potential that she has acute pancreatitis. Also has a history of things like high cholesterol, type 2 diabetes, and Sjogren's syndrome. These are important to note because it ultimately can impact how the intervention plays. Now, she also has been removed from her diabetic medication because it could be the cause of her pancreatitis. Some data to collect would be how heavily she leans toward using the Cherokee medicinal herbs and how she practices in comparison to modern medicine. Another thing that I would also want to collect would be her daily activity level, as this can also help in determining different factors in regards to her intervention. Now, when it comes to pertinent information related to nutrition, all the diet and medicinal items that are related to the Cherokee tribe are important to get to ensure the nutrition intervention does not contradict her beliefs. This is super important, especially when it comes to cultural competence, to make sure that we are aligning with what she truly believes and the lifestyle that she follows, to make sure that we are not offending or disrespecting her in any way. It is also important to be aware of this before implementing any plan to make sure that she feels more comfortable and that when we're setting goals for her, she feels more comfortable and feels respected in regards to those pieces as well. The other thing that I would want to make sure of is if she's using items that were mentioned like mint tea, wild ginger, wild rose, buckbrush, or any other items that fall under the medicinal herbs. PES statement that I have written out is that she has acute pancreatitis related to type 2 diabetic medication usage, as evidenced by increased levels of triacylglycerol lipase, nausea, vomiting, and abdominal pain. Now, when it comes to her nutrition prescription, I do believe that with patients who have diabetes, it's important to modify their lifestyle in order to reduce the risk of acute pancreatitis, because oftentimes those who have type 2 diabetes are more at risk than others. I would also utilize both forms of nutrition education and nutritional counseling to encourage her to not only understand the what behind her diagnosis, but also understand how her overall nutrition and health status can be monitored and managed through nutrition. I would also touch on her other diagnoses, as it would help to implement that as a part of her plan, especially when it comes to her Sjogren's syndrome in regards to her water intake. She did present for dehydration when she came in, and so that is something to make sure that we're implementing proper water intake as well. The other thing would be implementing a high protein, fruit, vegetable, whole grain, low fat dairy, and other lean protein diet, as well as avoiding alcohol and greasy and high fatty foods. These are going to help her in regards to her diabetic management, as well as that potential risk for acute pancreatitis in the future. As I had mentioned earlier in regards to cultural competence, as a Native American woman, this means that we should not only be learning about her culture, but listening to her directly and about her role in her culture, as well as how it plays a role in her lifestyle. And then also what she continues to practice in order to make sure that we are best assisting her in determining a goal within motivational interviewing. This means actively listening to anything that she has in relation to her culture, as well as her lifestyle and beliefs. Traditional modern options may not suit her lifestyle, and that's important to learn that through the process of speaking with her and making sure that we're kind of applying to that diverse background that she has. I chose this infographic for JC because with patients with diabetes, it is important to modify their lifestyle to lower their risk of acute pancreatitis. The items shown include those with high fiber, magnesium, and potassium, along with items that are going to help stabilize blood sugar, like dark green vegetables that again also contain high fiber, vitamins, and minerals, along with items like salmon that reduce triglycerides, lower blood pressure, and decrease inflammation, as well as items that are full of healthy fats and help deliver vitamin D, like fat-free dairy, and as well as berries that are packed with antioxidants and other vitamins, along with sweet potatoes. These superfoods will help JC manage her diabetes. When it comes to her nutrition monitoring, in order to properly monitor JC, it will be important to utilize lab data. Of course, that is how we were able to figure out just the risk that she had for acute pancreatitis, having those high glucose and high lipase levels. Utilizing other means of nutrition monitoring can also be helpful in our intervention with both nutrition quality of life and her physical appearance. It is key to monitor her glucose and lipase to ensure the health of her pancreas.